Welcome back to the channel. In our video about Jessica Petway, the beauty influencer who passed away from cervical cancer due to being misdiagnosed, I said we would upload a video about cervical cancer. Just a quick disclaimer, we at Black Girls Living Well are not medical doctors. We are just sharing information based on our own research and experiences. This is not meant to be taken as professional medical advice. Please consult with your doctor or qualified healthcare provider before making any decisions related to your health or medical treatment. We cannot be held responsible for how you choose to interpret or act on the information provided in this video. Cervical cancer is one of the most common cancers affecting women worldwide, but it's also highly preventable with regular screening and healthy lifestyle choices. In this video, we'll cover the key facts about cervical cancer, its causes, symptoms, prevention methods, and treatment options. What is cervical cancer? Cervical cancer is a type of cancer that starts in the cervix, the lower part of the uterus that connects to the vagina. The cervix is made up of two main types of cells, squamous cells and glandular cells. The majority of cervical cancers are caused by changes in the squamous cells as a result of persistent infection with high-risk types of human papillomavirus. Human papillomavirus, HPV, is a very common group of related viruses that can cause warts or abnormal cell growth. There are over 200 different types of HPV, with some strains being more concerning than others. Certain high-risk strains of HPV can lead to cervical, anal, and other genital cancers if left untreated. Low-risk HPV types may cause genital warts or warts on other parts of the body. HPV infections are incredibly widespread, and most sexually active individuals will contract some strain of HPV at some point in their lives, often without any symptoms. However, in most cases, the immune system can clear the infection on its own over time. Cervical cancer causes and risk factors. As I mentioned, HPV infection is the primary cause of cervical cancer. HPV is a very common virus that's transmitted through sexual contact. Most women will contract HPV at some point in their lifetime, but in many cases, again, the immune system can clear the infection on its own. However, if the infection persists, it can lead to precancerous changes in the cervix that may develop into cancer over time. Other risk factors for cervical cancer include smoking, having multiple sexual partners, a weakened immune system, long-term use of birth control pills, and a family history of cervical cancer. Let's talk about the symptoms of cervical cancer. Early-stage cervical cancer often has no symptoms, which is why regular screening is so crucial. As the cancer progresses, some possible symptoms may include abnormal vaginal bleeding, such as between periods, after sex, or after menopause, unusual vaginal discharge, and pain during sexual intercourse. Prevention and screening. The best way to prevent cervical cancer is through regular screening and the HPV vaccine. Other important ways include not smoking, using condoms, and voluntary male circumcision. Pap smear tests look for precancerous changes in the cervix, while HPV tests detect the presence of high-risk HPV types. According to the Centers for Disease Control, if you are ages 21 to 29 years old, you should start getting Pap tests at age 21. If you are ages 30 to 65, you should talk to your doctor about which testing option is right for you. And if you are over 65, your options will be based on the history of your Pap and HPV test results. The link to the CDC's information about cervical cancer screening is in the video description of this video on our YouTube channel. Also, if you are low income or have no health insurance, you may be eligible for free or low-cost screening through the National Breast Cancer and Cervical Cancer Early Detection Program. That link is also in the video description on YouTube. The HPV vaccine is also highly effective in preventing infection with the HPV types that cause most cervical cancers. The vaccine is recommended for boys and girls around ages 11 to 12, but can be given as early as age 9 or up to age 26 for those not previously vaccinated. The vaccination is not recommended for everyone over age 26 because most sexually active adults over that age have already been exposed to the HPV virus. However, you may still discuss your options with your doctor. The link about the HPV vaccine is also in the video description on YouTube. Let's talk about treatment options. If precancerous changes or cervical cancer are detected, there are various treatment options available depending on the stage of the disease. For early-stage cervical cancer, surgical removal of the cancerous tissue or the entire cervix, hysterectomy, may be recommended. More advanced cases may require radiation therapy, chemotherapy, or a combination of treatments. In closing, cervical cancer is a serious but highly preventable disease. By getting regular screenings, practicing safe sex, not smoking, and considering the HPV vaccine, women can greatly reduce their risk. If you have any concerns or symptoms, don't hesitate to speak with your doctor. Early detection and treatment are key to the best possible outcomes. Remember, knowledge is power, and being informed about cervical cancer can help save lives. Be sure to like this video and subscribe or follow. Thank you for watching, and please share this video to help spread awareness about this important women's health issue. Take care of yourself.